Here we have a case study of an unknown condition that I'm presenting based on my paper. So the situation at hand is that a 13-year-old girl has been brought to the emergency department by her parents, and she has a variety of different symptoms that we will see on this next slide. So her parents brought her here specifically because of two reasons that are very characteristic symptoms of the disease that I'm talking about. Some of the more moderate symptoms include having a sore throat, fever, a bright red rash on the chest, which is one of the reasons that they brought her here, and large lymph nodes, which are fairly common, and also a condition called strawberry tongue, as seen in the top right, where the tongue sheds the tissue off of it, and the only thing that is visible is the white tip of the papilla of the tongue. This makes your tongue look like it's a strawberry, hence the name strawberry tongue. The other main condition seen in the bottom left is a bright red rash that appears on the chest. I've actually had this condition before, but I won't tell you what it is until later. So, due to the condition, or the nature of the condition, I should say, they ordered a throat swab culture. Obviously, if they've got symptoms appearing in the mouth, you want to get a throat swab culture done. They also ordered a rapid antigen detection test, which is pretty characteristic for diagnosing the disease that they think she has currently, which I will still not tell you what it is. But that detects the antigen that this virus produces, or not virus, I should say. They also ordered an erythrocyte sedimentation rate test, which is a measure of the body's inflammation at the time that it is taken. They also ordered a gram stain to see what the organism looks like, an endospore stain to see if it produces endospores, which could be dependent on what type of organism it is, as well as a complete blood count. As for the testing, the rapid antigen detection test showed that the presence of Streptococcus pyogenes antigens was present. The throat swab culture also showed the same thing with the growth of isolated Streptococcus pyogenes colonies. They show this up in the top right. They used the streak test to isolate these colonies, and they showed that they were growing. The complete blood cell count revealed that white blood cells, specifically neutrophils, were present in an elevated level of 80%, showing that there's an inflammatory response happening here. The erythrocyte sedimentation rate does show an inflammatory response in the body. And the gram stain shows that there are gram-positive coccus-shaped chains of organisms seen in the bottom right, as well as the endospore stain coming back as negative. So what disease did this 13-year-old girl have? This specifically is highlighted by the characteristic rash, the strawberry tongue, and the fever, as well as the presence of Streptococcus pyogenes. I'll give you a moment. Okay, so the diagnosis by the doctor was scarlet fever due to the infection of Streptococcus pyogenes. This rapid antigen detection test tests for the presence of a pyrogenic antigen, which is produced by that strain of Streptococcus. Pyrogenic antigens produce that characteristic fever that was seen in the earlier slide that they brought her in with. Characteristic symptoms like the rash and the tongue appearance are also really telltale sign of scarlet fever, which I have had before and is not fun. What did they prescribe her? They prescribed Tylenol in the emergency room to try and get her fever down. They prescribed her some antibiotics, penicillin and amoxicillin, to be administered intravenously in the hospital. After discharging her, they gave her some oral penicillin to keep on top of the antibiotic regimen to fully get rid of this pathogen. And they also tested her parents using what is called the Dick test to determine the susceptibility in people who are not infected with this disease. Lastly, the patient was prescribed their oral antibiotics and is expected to recover in 2 weeks. They returned to the hospital and confirmed that she no longer had an infection. It was also confirmed that she was now regaining the strength of her immune system as her hair had started to fall out and her nails had thinned during the time that she had scarlet fever, due to her body's immense toll on fighting this. She returned to school and reported that after her 2-week checkup, many others in her school had started to develop symptoms of this. Eventually, her classmates were all kind of dropping out of class for having different symptoms of scarlet fever. And later, several months later actually, she was actually the first person to have acquired this in an epidemic that has widespread across her school, to the point where she was the only person in her class who did not have the disease. To summarize, a 13-year-old girl contracted scarlet fever and was brought to the emergency department and was subsequently admitted to the hospital. She received a multitude of tests which confirmed the diagnosis of scarlet fever due to infection Streptococcus pyogenes. After antibiotic treatment, she was free to leave. Upon her checkup visit, she divulged that she was patient 0 in an outbreak at her local middle school.